everyone, we welcome you at our YouTube channel with Arujan, and today we will be talking about early sexual relationships, their consequences, and the solution that we suggest. First of all, what are early sexual relationships among teenagers? Early sexual activity, often defined as initiation before the age of 16, is a risk behavior associated with negative health outcomes in adulthood, PMC 2020. It is reported that by 19 years, nearly 70% of both males and females worldwide have ever had sexual intercourse, Omona and Ssuka 2023. Hence, we can see that the problem is really global among society. The causes of this problem are often considered. Contextual factors, such as disrupted family structure or low family support, were the characteristics most strongly associated with early sexual activity. This problem is, of course, affecting teenagers' psychological and physical health. But let's talk about physical health issues the early sexual relationship can lead to. Early sexual relationships among adolescents can lead to sexually transmitted infections, STIs. More than 30 different bacteria, viruses, and parasites are known to be transmitted through sexual contact, including vaginal, anal, and oral sex. 8 pathogens are linked to the greatest incidence of STIs. Of these, 4 are currently curable: syphilis, gonorrhea, chlamydia, and trichomoniasis. The other 4 are viral infections: hepatitis B, herpes simplex virus, HSV, human immunodeficiency virus, HIV, and human papillomavirus, HPV. STIs have a profound impact on sexual and reproductive health worldwide, WHO 2024. Out of all these 8 infections, let's look at human immunodeficiency virus in a detailed account. HIV is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex. HIV is most commonly transmitted through vaginal, anal, or oral sex with an infected partner. The virus can enter the body through the mucous membranes lining the vagina, rectum, penis, and mouth. The mucous membranes in the vagina, penis, and rectum are particularly susceptible to HIV infection, Mayo Clinic 2022. These tissues are thin and can have small tears or abrasions that make it easier for the virus to enter the bloodstream. Existing sexually transmitted diseases, STDs, can cause sores or inflammation in the genital area, which can increase the risk of HIV transmission, WHO 2021. In women, HIV can affect the vaginal and cervical tissues. The virus can be present in vaginal secretions, and infected women can transmit HIV to their partners through sexual contact. Moreover, HIV can complicate pregnancy and childbirth, potentially leading to mother-to-child transmission if not properly managed. Nevertheless, there are some solutions to treat the disease. A. Comprehensive sex education. Comprehensive sex education is crucial in addressing the biological mechanisms of STI transmission, including HIV. It can provide adolescents with a detailed understanding of the biology of HIV transmission. Understanding how HIV infects CD4 T cells, replicates, and eventually leads to immune system compromise is essential for grasping the gravity of the disease. B. Access to healthcare services. This includes access to testing facilities that can detect HIV infection early through methods such as antibody tests, antigen tests, and nucleic acid tests. Early diagnosis is crucial because it allows for timely initiation of antiretroviral therapy, ART, which can suppress viral replication, reduce viral load, and slow down the progression of HIV to AIDS. C. Community outreach and support. Biologically informed community outreach programs can play a significant role in combating HIV transmission. These programs can educate communities about the biological factors that contribute to HIV transmission. Our chosen solution is an antiretroviral therapy. Antiretroviral therapy, ART, is a cornerstone of HIV treatment that involves the use of a combination of medications to suppress the replication of the HIV virus in the body. RT works by inhibiting different stages of the HIV life cycle, preventing the virus from multiplying and reducing its viral load in the bloodstream. This, in turn, helps to preserve immune function, improve overall health, and reduce the risk of HIV transmission to others. Now, let us evaluate the treatment from the social and economic point of view. First of all, the advantages for social factor are, firstly, increased awareness and education. ART programs often come with education initiatives that raise awareness about HIV and reduce stigma. For example, UNAIDS reports that comprehensive HIV education has led to increased knowledge and reduced stigma in several countries, such as South Africa, where awareness campaigns have helped decrease the stigma by 20% between 2010 and 2019, UNAIDS 2020. Secondly, HIV medicine reduces the amount of HIV in the body viral load to a very low level, which keeps the immune system working and prevents illness. This is called viral suppression, defined as having less than 200 copies of HIV per milliliter of blood. According to a Mendez 2019, in the EU-EEA, 24 countries, 77.5% of the people diagnosed with HIV infection were on ART, and of those, 86.6% had attained viral suppression. Evaluating this factor, it also has some disadvantages, such as mental health issues. The psychological burden of living with HIV, compounded by social stigma, can lead to mental health issues such as depression and anxiety, affecting adherence to ART. According to Mental Health America, 60% of young people living with HIV have reported experiencing mental health challenges, which complicates their treatment adherence. Mental Health America 2021. Now, let's dive into economic factor. Advantage of antiretroviral therapy is economic investment in healthcare. Investments in ART programs improve healthcare infrastructure and access to treatment. PEPFAR has invested over $90 billion globally, significantly improving access to ART and related healthcare services. PEPFAR 2020. Despite the positive economic side, there is a drawback as high costs of ART. The cost of ART can be prohibitive, especially in low-income countries. Even with generic options, the price can be a significant barrier. The average annual cost of ART per person in low-income countries is about $100, which is substantial relative to average incomes. Concluding our video, addressing the consequences of teenage sexual relationships, particularly regarding STIs like HIV, requires comprehensive strategies, including education, healthcare access, and community support. Antiretroviral therapy, ART, significantly improves health outcomes but is influenced by social and economic factors. Thank you for watching this video. Hope it was helpful. See you soon!